I'm joined by Nicole Dunomes, the manager of the Pre-Service Contact Center at Tufts Medicine. Nicole is joining our upcoming patient access meeting taking place this February on a panel dedicated to aligning pre-service operations, focusing on registration, eligibility, and scheduling. Nicole, thanks so much for coming on today. To get started, could you tell us a little bit about your career journey, both how you got your start in healthcare and some of the roles that you've enjoyed thus far?
Sure, no problem. Thank you for having me. Began my healthcare career working in a home health agency while I was in college. I landed this position in registration. How I got into the healthcare world was just by joining, having that as my first job. And healthcare was not my first choice. I went to school to be a teacher initially, and that's what I started doing. I started working in the home healthcare field, and I really started liking the whole healthcare aspect. And so throughout my first years of college, I kind of had healthcare jobs. And then I was offered a position at an organization working nights and weekends in the emergency room. And I really felt like that was where I had my pivotal change. I started receiving opportunities within the organization I was working for advancement fairly quickly. So although I joined that organization as a part-time employee, I was only a part-time employee for about a month. And then after that, I started obtaining leadership roles. So I had a lead role, I had an administrative assistant role, which was a supervisory role. And then just really tried to make a decision. Is this where I want to go for the future? And so I did change my major along my college career to management, and just really started to develop and figure out what type of healthcare role I wanted. Was it strictly leadership? Was it something else? And decided that management was best for me. I did acquire additional roles very quickly, from all the way up into a consultant within a 10-year span, to be able to use the skills that I had learned in the past to grow and develop to be on a consultant level. So that is the highest I would say of my career goals. It has been a consulting. I've had a number of client-based roles where I might have gone in as a patient access manager or director to support that team, but it's really a client-based environment. And now I'm in a space where I am doing something I had done in the past for an organization from a remote perspective, which is totally different for me. But it's absolutely very rewarding, and just bringing the experiences and really training and teaching my teams what their importance is, and how they can articulate what their own purpose is within healthcare. So I believe in mentoring staff and doing those types of things to be able to help people to not only just, in my theory, get a check, but to understand the importance of what they do and how what they do in the very beginning of a patient's care will bring them all the way through. And then, it's a domino effect. So I think my career has always been focused on inclusion of my teams, mentoring, supporting the growth of my team members so that we can, give the best customer service focused care to our patients. And then also just having a collaborative work and expectation within the healthcare with all the other teams that I work with to be able to provide exceptional customer service to our patients. And then I just have never chosen to forget, I used to be a patient access representative, or back then it was a registration clerk, in that environment. And that's how I've always managed. It's always been a teaching type of environment because I felt learning about what I do and understanding it well was the best way for me. And so that's how I've taught my teams.
This is such an inspiring story, and I think that your team is so lucky to have somebody working with them who's really focused on developing their skills and also, as you say, putting the patient first. Right. And getting that journey started on the right foot is such a critical component of the whole revenue cycle and the whole patient financial experience.
Correct.
Go ahead. Sorry.
I'm saying I agree.
We have you joining our panel coming up in February on pre-service operations, so aligning registration, eligibility, and scheduling. With your own team, what are some of the areas you're looking to improve during the year ahead in 2024?
I think because we converted our EMR recently from various other systems. We are a 4-hospital system to Epic. That's been a big challenge just from an organizational perspective. So not only pre-reg or pre-services are being, developed with those, we're also becoming a system. Those 4 hospitals are becoming one. So those are some of the challenges that we're experiencing, but also just with the newness of Epic and developing our workflows and collaborating with other departments. Those are some of the opportunities that we have, is to develop our department so well that they understand what our workflows are. Because, it's typically when organizations are combining, everybody kind of wants to keep a hold of their own workflows and ownership of those workflows. But understanding how a pre-service department as a whole, because there are other pieces of the pre-service department outside of pre-reg, but being able to see the value in the before the patient walks in the door, and keeping their service times in the waiting rooms shorter by having all of this work done prior to those patients arriving, is a part of the development that we're building now, and we're expanding outside of what we initially started with at Go Live. So bringing on those other teams, and where it's being developed in a way where now we are so much further ahead, getting our patients pre-registered. Those areas that might have given a bit of pushback are now requesting for our services, which is always a good thing. And we've always known we would expand outside of the initial group that we would pre-reg for. So developing those relationships, making a hassle-free environment for our patients so that when they come in, they just go to their service. That's what we're trying to focus on. And of course, bringing automation into that as much as possible to facilitate getting more registrations done before those patients show up, and that they feel confident before they walk in the door to have their services. They've had all their financial clearance done. They've asked all their questions, and those types of things are done before they come in. It just helps with all the patient flow.
Absolutely. And it sounds like a really exciting project to work on and to bring all of those pieces into alignment. And it's wonderful to hear that you've got other departments now coming to you and saying, hey, let's implement this with our group as well. It's obviously a testament to how well it's going. So congratulations. That's very exciting.
Thank you.
With the upcoming panel in February, what's one thing that you're looking forward to discussing either with the panelists or with the audience members during that session?
Well, I'm always looking to, just being able to collaborate with other organizations, other teams within the revenue cycle, and just from an organization perspective in healthcare, because we all think we might be doing it great, but you always learn something from somebody else, or there's some workflow that they do differently that all we need to do is tweak and we can be just as efficient. So I'm looking to hear, the questions from the audience, the comments from the other panelists, to see how I can leverage that information on my team and share that with my organization. So I'm really looking forward to those conversations that we'll have and the questions that are going to be asked.
Absolutely. And I think that's one of the greatest values to this type of program, is that you do get to kind of hear what other people are doing and say, oh, hang on, I could implement that as well. Or like you say, just kind of tweak it slightly, and then improve your results even more. And we really encourage that type of collaboration and just sharing what every organization is doing. We really look forward to having you on the panel, and I appreciate you taking the time today. And I thank you so much.